Good morning. I'm going to do a PowerPoint presentation here for my fundamental students or anyone who would like to listen about professionalism, clinical issues when you go to clinical, and things that you should know when you become a licensed nurse. So let's talk a little bit about some terms that you hear all the time when you talk about professionalism. Okay. The first one is accountability, the responsibility of an individual or an organization to answer for its activities. It involves accepting the consequences, positive and negative, of your actions. This is a principle. It means that you're transparent and honest in different processes and your decisions. It's a cornerstone of trust that you have. Integrity is being honest and being consistent and uncompromising adherence to your moral values. If I, for example, if I run into a patient that is not my patient, I try to help them. Okay. Um, Ethics tie into this. It's truthfulness, earnestly, being honest with people. If you don't know an answer, tell them. Don't not being a jerk. Okay, it's kind of an interesting thing. The green box on here says talking about a professional appearance and conduct. You have to follow dress policies at locations where you go, respecting patient confidentiality, and just have a commitment to lifelong learning and understanding the way things work. So, some common things that I want to share with you that all clinical experiences at any school are going to expect from you and that you are accountable for and need to be professional about. One of the first ones is being on time and accountable to report to your instructor if you will not be attending. I've been at several schools when I got my master's. I'm currently here at a school, and that all the schools that I were at had a similar policy. You needed to be on time for the clinical time, or you needed to notify your instructor. Okay. If you were unable to attend the clinical or lab time, you needed what was called a legitimate excuse. An example being a sick child that you had to take to urgent care, you would have the urgent care note. Your car was towed, you had to tell the tow truck driver you need a copy of the receipt. Maybe you were in urgent care. We've had people with a funeral suddenly in that morning where you can bring the death certificate. These are all things you could have a note that could provide explaining why you did not attend the clinical. Those clinical hours are regulated by the boards of nursings of the state you live in. For me, it's the state of Ohio. So if we say we're going to have 90 clinical hours over so many weeks, we have to have you there for that time. That's why you're not supposed to leave early. That's why they regulate it so heavily. Okay, so you have to show that if we show that you didn't come in, I can't just say, she didn't feel good, she had cramps. It has to be something where you something serious and you have to report it to me. And I have students all the time, they mess up on this. Maybe they had a legitimate problem in the morning and they do what's called a no call, no show. They treat these clinicals like a job. Should they, or do you agree with that? I don't know, and I don't really care. You have to understand what your attendance policy is if you're going to go to school for any type of job that's similar to nursing. Okay, and you will need to be on time for your job. And so many people, I had a clinical and I was waiting on students and it's supposed to start at 7. And I had this little talk with them in person, and I'm waiting at the door for them to let them in because they didn't know the code to get in. And I'm waiting there, and they roll in there at 6:59 and 30 seconds. Well, if they had had to walk a long way to get to me, they would have been late and I would have had to send them home. I have to follow policy wherever I work. And policy was they needed to be there at 7 and they knew that ahead of time. This is no longer your job where you're an aide and you just rolled in and got a quick report. You need to show up 5 minutes early. Plan on being there 5 minutes early. If you need to do a practice run to the facility, in your car and see how long it takes you to get there. And don't forget, in the morning, every single goober is out on the road driving bad. And there's also bad weather to think about and rain. And maybe your car won't start right away. You can't find your car keys. So you need to kind of get yourself organized a little bit. And that's not anything that we can't. We have a right to ask that if we're out of school. I have a right to ask that as a registered nurse if you're coming to a clinical with me. Okay. And remember, you need to document if you're not going to be there. Let the instructor know as soon as you know. I had a girl in a car accident. She actually continued, had her dad drop her off at the clinical, and then she came and said, "I've been in a car accident. I have a police report, and I'm not here for the day. I have to go to the hospital. And we're going to go and check me out at the ER." That's the right thing to do. I said, "I'm so sorry. I felt terrible," but she notified me. She produced that note at the ER where they checked her out and made sure she was okay. They let her make that day up, and that's perfectly following the policy at the school she was at, and perfectly she was a perfect professional. So, a little bit more about being professional and what is expected of you at a nursing clinical. Number one, yes, your instructor can ask you a question about your patient. I asked a student, I said, what can you tell me about the patient? Says, you ask a lot of questions. I'm your instructor. I'm trying to see what you know so you can pass your test. If you don't know, you can tell me, I'm a little clueless right now, Miss Bible. Can you give me a couple minutes? I'm okay with that. But your instructor has a right to ask you when you go to pass meds the first time, they can say, do you know what you're passing? If you don't know, you can be honest. All right. I think we live in a big society now with the internet controlling everything, where there's all these lying and carrying on, and where we fake pictures that we put on the internet, and people don't know how to act. If I say, "Do you know what acetaminophen is for?" and you have a brain fart, you can tell me that. I had them. I had days where I don't know what did I put your grades in? I forgot or whatever, something happened. But it happens. So I tell you honestly and authentically. Say, yeah. You can turn around and say, you know what? I think this was the one I looked up for here. Do you mind if I look at my notes or can I look it up again? And I'm okay with that. I want you to know that drug, especially acetaminophen, which is Tylenol. But we can talk about that. That doesn't mean you can't continue on here today. It doesn't mean you failed your day. But your instructor has a right to ask you about the patient or what we know. And number two, there is no life expectation that you like everyone that's going to be at our clinical, everyone that's on this job that you work on or whatever. It kind of clinical is kind of like a job where you're not getting paid, and I know that, and I know that drives people crazy. That's how nurses have gained experience. If you look back in history, and you don't have to like every decision I make or every decision the facility makes or every decision that is going on there, and barking at me all day long about how bad you hate it or how bad and carrying on is not helping you learn your material. You need to spend more time working on learning your nursing material. Look, we need to talk about you guys is in your phones. Okay? And a lot of the clinical instructors that I work with are going with no phones at all. And what normally happens is I say no phones and somebody turns it on vibrate or they have it on what they think is silent and I see it going off in their pocket. I've had students misuse this phone issue more than anything else. I've had people taking selfies. I've had people try to take a picture of a patient, which is breaking HIPAA. I had to stop that. I said, you can't take it. Oh, I gotta talk to my kids. Listen, we made it for years without checking on our kids every hour. Your kid will be fine. Am I? If you come to me and you are in my clinical, this is specifically for me, but I think it probably holds for any clinical instructor, and you got a problem going on with the kid, he's at daycare, and you may need to check on him and maybe say, we're going to start here at 8 o'clock out on the floor. Mrs. Weibel, can I check him at 10, go and count the daycare at 10 and make sure his fever stayed down? Of course, I'm not an evil witch here who's not going to let you do that. But you sneaking in and doing it sneakily makes you unprofessional. Say something to me. Say, I got a problem. They're going to call me and tell me how he's doing at 10 and if I need to pick him up or send his dad. I'll have you step out into the lobby, please. You can go take a call and talk about and find out what's going on with your child. I don't have a problem with it. I have a problem. You're not always doing things important. I see you. You're on TikTok, and TikTok is the biggest offender. Okay? I've had so many people come in for and I do a lot of extra tutoring now. I'm the preceptor coordinator here at the school that I'm at, and I have a lot of people come in. If you have a minute to help me with some learning, and I ask you how much time did you actually spend? I was all day yesterday studying. I said, how many hours did you go over to TikTok? Well, I was on TikTok a little. I might have been on TikTok like 6 hours. You didn't study all day. You are being distracted by that. And I certainly don't have a problem with getting your phone. I know your Google Pay is on there if you're going to buy lunch and a lot of things like that when you pay for lunch at a hospital. So it's kind of a problem. So I don't have a problem, but I am tired of people being unprofessional with their phone. I'm trying to give them information even. I went over an exam one night in post-conference and everybody was trying to put on their phone. And they'll probably say, I didn't know that was on the exam. You dummy. I just went over it. Pay attention. Take some notes. Bring a pen. The other thing would be, why do you people not go to Dollar Tree and buy a pack of pens? I'm sick of loaning you my pens. Okay? I don't have a pen. You're a nurse. You need a pen. Go into Dollar Tree. I will tell you there's one batch of them in Dollar Tree. They're $1.25 that are crap. The other batch is pretty good. I buy a pack, throw them in. You are a professional now. You need to have a stethoscope, and probably a sphygmomanometer of some kind. And you need a pen, all right? Or maybe a black Sharpie marker. All right, and that is just what professionals do. My son has a degree, and he works on automobiles. He already knew a lot about autos because my husband is in autos, but he actually got a degree, a small business degree. And when he goes and he checks your car, he brings his tools. He brings some little thingy bobber he plugs in. I had a light go on my, one of those idiot lights came on in the dash, and the car was running fine, but he plugged in and he read the screen to tell me what it was, and it wasn't anything. It was something to do with one of the oxygen sensors, usually not cheap to replace, but easily fixable and not going to harm me to drive back and forth to work. He's a professional. He talks professionally to you, even though he sometimes gets a little greasy working around cars. He talks professionally if he sells you tires on Facebook Marketplace that he has. He does that, and he doesn't let his phone distract him there, okay? So just think about that. The next thing is you need to be in your uniform for whatever your school or school or workplace policy is. And inevitably, someone goes, nobody at my job has their nails. They all have their nails done up, and they wear whatever they want. I don't care. Okay, I don't care. They look like morons in the hall. You should be over where they know you're the nurse. Trust me, you will gain a lot of respect if you are in a uniform and you look like you're the nurse there, okay? You can dress up when you go out on a date Friday night. Go hot and go beautiful. I love it when you guys show me your pictures when you're going out on a date or you went out on an activity or a party. But when you are working, you keep it professional. And I don't care what the people at your work are doing, okay? And the school, any school you go to has a right to enforce the uniform policy. This is another giant pet peeve of mine, so let's just kind of talk about it. And I think it gets under you guys' skin because you don't understand. There is a thing called activities of daily living. Activities of daily living means what I do to day during my life, okay? And so when we go in a lot of times for fundamentals, you're at what's called a long-term care facility. You all say nursing home. Quite a few of you tell me that you already work at a nursing home. You work as an STNA. And unfortunately, people that live in a facility sometimes they need a lot of help with their activities of daily living. And that a lot of times that can be incontinence where we have to change a brief, or they need help with the bath during the day, or they may be on what's called the shower list. They don't do a shower every day for everybody in case you have not been in a facility. And I have heard the most bitching about that I think a lot of people think if they go in to be an LPN or an RN that they're not maybe going to have to ever do anything like that. I need you to stop and I need you to think a little bit here. Human beings like to be clean. When they're dirty and sweaty, it helps them feel better if they wipe their face and hands off. This is basic nursing 101. In a nursing home setting, it sometimes has a lot of personal care that you have to help with during the day. Even as an RN, I worked at a hospital. People want to go home for surgery. They want to wash their face and hands in the bathroom. And it's not about the bath. Okay. I need you to stop and think for just a minute. I'm teaching you to assess them. We're going to teach the fundamentals level learns a head to toe assessment. They learn vitals, how to do vitals, glucose, and a head to toe assessment, including listening to lungs. And that nursing home or that long-term care facility is usually the best place to do that, where they appreciate the help very, very much. And the residents usually appreciate the attention, and you can see a lot of people that maybe are in that tertiary stage of trying to get well, okay? And you griping about it all day long is not adding to your ability to learn to be a nurse. I can tell you right now, if you go into a long term into a hospital, if I need some sort of care, they use it. If I had surgery this summer, and the nurses used it, and when I went into the bathroom, the occupational therapist actually come and I said, "Oh, hello," and she said, "Hello, I need to make sure you're going to be okay at home to get around and get your clothes on." She's looking at my activities of daily living. She's assessing me. So I get dressed. I got myself in the bathroom. Even an LPN had walked me to the bathroom at one point. I had low blood pressure, and I said, "Well, I'm a nurse. I'll be okay." She said, "No, no." She said, "I'm kind of assessing. We have a note. You can go home first thing in the morning as long as you're navigating around here real well with your walker." That's they're assessing me. That was nothing to do with me going to the bathroom. It kind of is because they make sure you go enough after surgery and you're not dehydrated. So it's not just the bathroom. I need you to get out of this fixation on, "Oh my God, I was just doing aid work." Shut up. What are you talking about? People's needs start on a low level according to Abraham Maslow and they go up, and you can't send somebody home who can't walk into the bathroom and pee on their own unless you get some, and you need to assess that. This is all part of this activities of daily living. So now that you are going to be a professional, you got to keep a lot of documents. And it kind of stinks. I ain't gonna lie to you. Because I'm like in my 60s now, so this is a lot. But let's talk about this a little bit. Before anyone can talk to you and hire you into a job, they check to see what your license status is. So if I would go and hire, I like my current job, but if let's say I wanted to get a job somewhere, and as soon as I applied, the first thing they have to do is download my license before they even talk to me, make sure I have what they call an unencumbered license. I don't have any dings on my license or anything. The other thing that I see that's pretty standard across the board is a yearly TB. It can either be the TB test where they screen you in your arm or the quantiferon. It depends on the facility, and you have and you and, it, and do you need a vaccination record of some kind? I don't work with peds, but I sometimes need to go to the children's area to visit with some of the preceptor students. So I had to have an MMR titer and all the titers that you had to have. And I actually had mumps at one time. I had to go and get a mumps booster. I was like, "Oh, this is crazy." You have to get a yearly influenza vaccination. You have to get a yearly background check, most facilities, and you need your 2-year CPR, either the basic life support or the advanced cardiac life support. So here's what I see that the unprofessional part comes. Once it is your job to watch your documents, okay? And I have nagged people here and been helping out because people can't go to clinical without the documents. And I'm sending email after email and trying to call and said, "Where is your stuff?" Whoa, excuse, excuse, excuse. Listen to me. I think you're grown up, so I think you need to learn to keep track of this yourself. So I'm going to tell you how I do it or how I keep track and keep prepared. Okay. I bought me the most expensive box I could find at Target. I call it Target, and real pretty box. And I keep a paper copy available, but I also keep a copy available now in a cloud drive. I can give you my license number from the Board of Nursing. I keep the TB that I had. I have my vaccination record. I actually got a letter that I didn't need all the boosters because of my age. I kept that letter. I have my influenza. It's located online. I can download. The background check came directly to the school, but I have a copy of my receipt that I scanned into my computer, and I have my CPR. I have them available at any time if I would want to work. And I don't need anybody to nag me about that. I keep it reminders. I keep a reminder. I actually use a desk calendar at home. And I know that makes me sound old fashioned, but they have things you can do on your phone where you just remind yourself, say, my TB is due. So I can tell you, I came back to work in June after my surgery, so I got my TB and my CPR this past year, right before I came back. And so the TB, something will be due for the TB next May. CPR will be due, it's a 2-year. My influenza I usually do in September. My background check I do towards August. I have where they remind me on the calendar. You can do an online calendar. There should be no reason. You guys are way better tech savvy than I am to know how to remind yourself that it is your job. Most the schools, at least, and the facilities use, at least here in Ohio. This is just here in Ohio. I cannot tell you what is done across the country. A lot of the hospitals use a program called AceMap to keep track of your documents, and AceMap also has little modules you have to do every year about basic patient care. You have your driver's license and everything in there in case they would have to contact you. The bad thing about AceMap is although you have to do those modules, usually the schools have you upload your documents once you get them done to another site and they don't talk to each other. You can always check with your school and check with the other site that we use. Has a name, Castle Branch. It recently changed names, but it could be any company. There's other companies across the country. You uploaded at Castle Branch, I look at it and have to put it over into Ace Match, which is kind of like to me, like not the most smooth system in the world. It is what it is, but it's your job to check those things. I don't think I'm your mother. I don't need to have to nag you. If you're going to be a professional, be one and own it. So let's talk a little bit about professional boundaries, how to maintain a therapeutic nurse-patient relationship and stay within your scope of practice, and most importantly, use social media responsibly. So I'd like to give you some information about social media. I'm going to give you a list of don'ts. They were too long to actually put on the slide. You're not supposed to put a ton of stuff on slides and just read them. The first thing is don't post a patient story. Even if you had the best of patient intentions, you could actually share some personal history and you'd be in violation of HIPAA. I would not indiscriminately post from your workplace. Even if you post a fun photo of you and your coworkers, there could be a patient family member or visible chart in the background. If they allow you to post while at work, check your surroundings. Before you post a picture, double check anything you write to make sure it's not infringing on a patient's privacy. Have another coworker look at it. Don't connect with patients or their family members online. This is not safe. Avoid discussing anything if you already knew somebody that comes in. Stop complaining about your employer. If you want to ensure that you stay in compliance with your organization's guidelines, make no mention of your workplace at all. Okay? Don't post anything that is shameful to the nursing profession. Nurses are really a trusted profession, but they hold you to a high standard, and it's the same on social media. They now have a principle of social networking in nursing through the ANA. We've seen nurses come on and post pictures of like where a patient maybe was bleeding on a piece of paper. That is just, come on, guys. Don't be shameless on when you do something just because you want to be a hot mess on the internet. The other thing I see is people coming in. You can't use your phone to just videotape anyone that doesn't give you permission. Okay? And that goes for here at school. If you're talking to me about your grade and you're unhappy, I'm going to videotape this. No, you're not. I didn't give you permission to do that. And also, if you're in a classroom and they don't give you permission to do the lecture, you can't do it. You have to ask permission. We do still live in a world that has some type of principles attached to it. I would just be very, very careful. You can use the internet. I use the internet a little, but you need to make sure that you are following these some rules, and there's more information at this white paper they've done on the social media with nursing, and I can certainly, if you get with me, find me in the hall, I'll try to give you a link to that site. And just as a side note, if you are not studying for nursing exams and using the teach back method, you are hurting yourself. A study guide, we're not going to give it to you because it's just me going over the question with you and you're memorizing it. They're not helpful with this type of material that you're giving you with the new NCLEX. Plan on using the teach back method. So an example would be you send home a diabetic, he needs to know what to do when his blood sugar is low. If he can explain what to do back to you, then he understands. If you can explain to me what acetaminophen is, then I know you understand. And that's how you have to learn it, where you can explain it to someone. I get this, and I've said this on another voiceover that I'm going to give to my new people and everyone. If you're using ChatGPT, you are making a huge mistake, because if you do that the night before an exam, you never knew the material to start with. And you need to know the material before you make yourself a study guide, right? I have another voiceover that talks about communication skills, because there's tons and tons of questions all through nursing school about using good communication. But let's just do a quick running review here. Always be an active listener. That means, and I have to watch myself. I have to slow myself down and really listen to people. But be an active listener where you're up and you're engaged with them. Try to do clear, concise verbal communication and ask open-ended questions. And that's what they ask you when you go into the doctor. They say, can you tell me what brought you in today? Can you tell me where you hurt? Can you tell me what's been going on? That's an open-ended question. There's no yes or no answer. Yes or no question is a closed question, which sometimes you need to do too. Bob, did you eat all 5 of these ho-hos? Yes or no? I need to know. His blood sugar is 500. You know what I mean? That kind of a thing. And then we want to be therapeutic. Those are therapeutic communication techniques. This is a therapeutic relationship, not me chatting about, I'm getting new boots for Christmas. I was just going to tell you guys, I'm getting a new pair of boots, now that my knee is better. And I was going to show you the boots and ask you guys what you thought. Well, that's not a therapeutic communication. That's just a casual conversation. Therapeutic communication is tell me how you feel today. Tell me how your knee's feeling today. Getting me to talk. That's how you have to talk to your kids when they come home from school. If you say, how was your day? Fine. Tell me what happened today. Tell me how your day went today. And my kids used to go crazy when I asked them that, because they had to answer that. They had to give me some kind of an answer. Okay? So remember your communication skills always. Here are some examples of open-ended questions. Can you tell me more about your symptoms? What concerns do you have today? This encourages patients and people that you talk to elaborate. Look, I want to talk about conflict resolution with your coworkers or your co-students. Look, you aren't going to get along with everybody. None of us do. You have to address any issues promptly and professionally. And how do we do that? Well, we don't need to be aggressive. There's a big difference between aggressive and assertive. Okay? You use assertive communication. Okay? And you have to go in, and when you talk to people, you have to focus on the problem, not the person. If you say things like, you're always not making me do your bath, you're always dumping on me, no one is going to respond to that. You're going to start out, can you tell me, is it okay if we talk a little bit today? And I was wondering if you can tell me what happened yesterday when all the baths didn't get done down the hallway here. Focus on what happened, okay? You have to seek an answer, not seek revenge. I see so many people just where they don't get along and they don't have a conflict resolution, and you aren't required to like everybody. You can't leave every job where you don't like someone. You have to try to learn to get along with people.
I had a nurse I'm working with someone in a hallway, and her and I were necessarily good friends. And she said, "Look, I know we don't always hit it off friend wise." She said, "Let's you and I knock this off and get these people washed up and get them home today." Okay, sounds like a plan. Address our issues. We don't have to be friends here. We have to be professional and be assertive with one another and not aggressive. I've had people get in my face and be aggressive. I don't do a good job when you do that. I'm not going to do that. Or you always. Or that instructor never did this. It was their fault. You need to focus on what the problem is, not a person. Okay. I want you to think about that as you move through your professional career. So, some steps for conflict resolution. You got to identify whatever the issue is and make sure it's clear. Listen actively to everybody that is talking to you. Try to find a solution and agree on a plan and try to follow up. So, I want to talk a little bit about de escalation. We kind of live in a violent kind of time right now, and you may run across a patient or a family member that is very, very angry and you are worried about your safety. Okay. Um, the first thing I want you to do is to stay calm if someone is yelling at you and carrying on and use a soft tone. I want you to have non threatening body language. I need you to acknowledge that other person and validate how they feel. Okay, and give them a chance and to try to resolve what's going on. An example to you, a patient comes up to the desk and they start screaming at me about their mom hasn't had their call aid answered in 2 hours. Whether that's true or not, I don't know. I don't think it's true, but when people are upset like that, if you stay calm and use a soft tone, non-threatening, I acknowledge, I said, oh my gosh, you feel like it's been 2 hours. I didn't say that it had been 2 hours. And when people come up and they kind of attack you like that, you feel defensive, like, I know what you're talking about. I'm working my butt off here. You feel like answering in that kind of a tone. But I don't want you to do that, okay? And give them a chance. Say, how about if I come down right now and let's see what's going on? And be honest. Could they have waited a while on the call aid? I work in current healthcare. They could have been waiting a while. I don't know if it was 2 hours. Well, let's acknowledge that that's frustrating for patients and they don't always know what to do when they're having to wait on the nurse. Okay, and how you and be always be open ended with them. Oh, tell my gosh, and be sympathetic and empathetic. I'm so sorry that you're upset today. Am I sorry that could they be wrong? But I am sorry that they're upset. I don't want to see people that upset. Go down, kind of take care of it. A big one I had just a few weeks ago was I actually don't work at the clinical side I'm at. You guys understand that I work for a school. And someone didn't feel like that her mom's bed had been changed. Probably what happened is mom refused to get up was my thought. But I didn't say that to them. I stayed calm. I tell you what. I said, how about I'm so sorry that you feel that way. I don't want you to be upset like this. This is an elderly gentleman. How about if we come and we grab a new pillowcase and a different pillow and see if we can fix this problem? Sometimes just a little nice kindness like that goes a long way to de-escalate somebody who could blow up in your face. If you aren't careful, people kind of get kind of grumpy if you don't address their issue and let them know. If you got three people at the desk and they all need help, say, guys, I'm going to promise you I will help everybody here. Just give me a second. And honest, authentic. Just be honest and authentic and tell them what you're at, and that kind of keeps them from escalating into blowing up at you. Because there have been nurses being hurt and during people escalating fights and things, I wanted to make sure that I also reviewed with you keep a safe distance from someone who is when you're trying to get them to de-escalate a little bit. Okay, know how to get an exit from a room if there's a problem. Call for help early. Don't wait until the situation blows up in your face. I'd stat page security. That's what I've always done. There's usually some institutional policies, but usually when someone's is in, I feel a dangerous situation coming on, I don't have the ability to go look up the policy manual to see what it is. A good one is always the stat page security. They know if stat page security to the sixth floor, something is going on. I actually had it happen. I leaned out and I told the secretary at the desk, I said, I'm going to need you to stat page security to the floor. I'm going to need more help. And that's what you got to do. But call early. Don't necessarily assume that you're going to be able to de-escalate somebody who could possibly harm you. I had a friend who actually got hit in the mouth from somebody who hadn't had his meds. They didn't know he was on psych meds. She had actually had a broken bone up in her jaw, and it's hard to de-escalate people. So I've seen a lot of issues coming up. I want to make sure you just kind of think about that and be in a situation where you can go get to safety right away. I don't want you hurt. I want you to have a good nursing career. Thanks for listening today.